Hello everyone, so today I want to demonstrate and talk a little bit about the galvanic therapy, or also known as the non-surgical facelift. So I have here my galvanic machine. Actually, this machine has different options. High frequency, brush, galvanic, vacuum and spray. So depending on the setting that you're gonna set, you can have all these modalities in one machine. So anyway, coming back to the galvanic therapy, this is a good treatment that can be used like once a month. It's good to tone the muscles, some macro lifting, and it will help to the absorption of product. So it infuses water soluble product. That's one thing you want to make sure they're water soluble. This is good on all skin types, and the benefits are promote the blood and oxygen flow, they clean and detoxify the skin, it's good for moisture and nourishment of the skin, it improves the skin elasticity, good for anti-aging, helps the penetration of product like I mentioned, and also for acne. It all will depend also of the product that you're using, obviously. There's just a few contraindications that you want to be aware of before you start the treatment. So it's all things that you will discover during the consultation. First, pregnancy is a contraindication, diabetes, any high blood pressure, cardiovascular issue, pacemaker, metal implant or metallic dental implants as well, any epilepsy, spider veins, or a recent dental surgery or a recent chemical peel. You wanna, that's also contraindication. If you see any wounds or abrasion on the skin, that's also contraindication. And if your client is taking any medication that could thin the skin. All right, so what you want to explain about the galvanic therapy is that just keep in mind that when you use it, you do a treatment with the galvanic, you always want to start with the negative pole first on the skin, on your client's skin, and then work with the positive. So for that, I'm gonna show you what I mean. So there's two plugs over there. So here, the negative is connected to, my roller is connected to the negative pole. So that means I'm gonna work with this one on my client's skin first. And this is the piece that the client will be holding. So this is on the positive. So that's the way you're gonna set up your machine. And this is just on, but it didn't start yet. It's still on 0. Once we start, I'll turn that little wheel. So I'm gonna show you what you do. So you take the handpiece that will be in contact with the client, that you'll ask the client to hold. You want to make sure it's wrapped into a wet, here I have a facial cotton wipe. So you just wrap it around and you'll have your client hold it. Sometimes what I do, if I see my client is relaxing, I will just put this in the back of the shoulder so that there's kind of a connection. So they'll hold it. And what I will do, I'm going to demonstrate on me. do, let me take a bit of cleanser. Sorry, it's a little tight. I'm gonna take some disincrustation solution and I apply a bit on my face. All right, that's a little interesting when you need glasses to see what you're doing. So when you start by applying the negative current on your client's skin, working with the negative, this is also called anaphoresis. So what it does on the skin is that it causes an alkaline reaction. So it's going to soften and relax the tissues. It stimulates the nerve endings and it will increase the blood circulation. This is also for disincrustation, so to prepare the skin for extraction. So I'm gonna hold this piece with this hand. Turn on my machine. Now you want to always ask your client if they feel anything. So it's totally normal if they're gonna feel a little something, but you don't want it to be uncomfortable. And then you start moving and rolling it. So you will see wherever they'll need more extraction, you just go ahead with your roller. Another thing, they might feel like a metallic taste in their mouth. That's also part of it. So once you apply on the skin, you want to keep moving, and also make sure you go everywhere like this, always holding this, the opposite pole. So I have negative pole on the roller working on my face, and I'm holding the positive pole. I'm gonna stop that, so I'm gonna stop and then I'm lifting the piece, the hand piece from the skin, and that will help with the extraction. I'm just gonna clean this. So the next phase, after you're done with your extraction and everything, and it's time to apply a serum, what you can do is, I'm gonna show you again. So the roller, we've been using it on the negative, so I'm gonna switch them. The hand piece goes to negative, and I'm putting the roller on the positive this time. This is still off. Gonna apply a serum which is water soluble. It's vitamin C serum, the one I'm using today. And the same thing. Now my the piece that I'm holding, or I would ask my client to hold, is connected to the negative, and I have the roller on the positive. So the positive current is also known as cataphoresis, and this causes an acidic reaction. It tightens the skin, calms and soothes the nerve endings, decrease the blood circulation. So this is called ionization. Earlier I said you always use negative first and then positive, but if you do a facial and you want to skip the negative for disincrustation because the client doesn't need it, you can just go ahead and go directly with positive first. It's just that you wouldn't do the opposite if you were gonna do both. You first want to clean the skin and then have the product help with the absorption of product. So that's why I said first and second. All right, so I have the serum on my skin. Gonna hold it and start the machine. And now I am doing cataphoresis or ionization. So this will help the product absorption. So that's something that you can do before applying the mask. And again, you may taste like a metallic taste, I just said that word, in your mouth, it's normal. So it does feel a little warm, but nothing that is like to worry about. It's actually comfortable. And you go over the whole face, make sure you worked everywhere that it needs to. And again, before you remove it, you're just gonna turn off, and now you can lift it up. And this is like a quick a quick way to show you how to use the galvanic current on the skin.